I'm Dr. David Navid, orthopedic surgeon. I provide care at Baylor St. Luke's Medical Group here in Houston. So hip replacement surgery basically involves replacing the femoral head, which is the top end of the femur, the thigh bone, and the hip socket, which is a part of the acetabulum. In this scenario, in case of hip arthritis, usually both surfaces are involved. So there is arthritis, lack of cartilage, wear and tear, that we go ahead and basically replace. So the acetabular component or the hip socket takes its own component or part, and then the femoral head is detached and we remove it, put a femoral stem, and on top of the stem goes the femoral head. And then we relocate the hip, and basically you can regain your full range of motion. That's what we're looking for. Remove any osteophytes, bone spurs, any debris that need to be cleaned out, and the hip is relocated, the wound is closed, and the rehabilitation period starts.